This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Built specifically for medical practices, Dr. Chrono includes an integrated feature that powers a seamless payments acceptance experience. Dr. Chrono Payments offers multiple ways for patients to pay as well as insurance credit card processing. As a Dr. Chrono customer, you can easily activate our fully integrated payment solution that will streamline your cash flow and help you get paid anytime from anywhere. Deliver the best patient experience with a fast and easy way to collect payments. Visit drchrono.com/payments. That's drchrono.com/payments to learn more about Dr. Chrono today. Is there a DPC clinician, tech vendor, or industry champion that goes above and beyond to further elevate the DPC movement? Nominate them for a DPC Innovation Award to recognize them for creating traction, embracing innovation, and demonstrating commitment to the movement. DPC Innovation Award winners will be announced and honored at this year's Hint Summit, taking place in Denver, Colorado, September 27th through 28th. Nominate a DPC innovator at summit.hint.com, plus get $50 off your Hint Summit 2024 registration with promo code My DPC Story. Today's episode is like a homecoming here at My DPC Story. Last summer, all of the following guests shared where their practices were, and today we get to hear what's happened over the past year. So if you want to hear about their beginnings, check out their previous interviews, and the links are on the blog accompanying today's episode. Now, on to the episode. Direct primary care is an innovative alternative path to insurance-driven healthcare. Typically, patients pay their doctor a low monthly membership and, in return, build a lasting relationship with their doctor and have their doctor available at their fingertips. Dr. Christina Mutch and Dr. Jake Mutch both attended college at William & Mary and then went on to attend the West Virginia School of Osteopathic Medicine. With the realization that the rushed 7-minute visit did not provide patients or doctors with adequate time to make meaningful lifestyle changes needed to control and reverse disease, they started Defiant DPC in Williamsburg, Virginia in August of 2020 and will be welcoming baby girl Mutch in a few weeks. Dr. Lauren Hughes is a board-certified pediatrician and lactation consultant and founder and owner of Bloom Pediatrics and Lactation. She provides all general pediatric services as well as breastfeeding services to her patients in Kansas City, Kansas, where she is the only IBCLC and MD in the state of Kansas. Dr. Hughes is a wife and mother of 4-year-old Calvin and 15-month-old twins Nolan and Sloan. Dr. Deepti Mundkur is an internal medicine graduate from the University of California, San Francisco School of Medicine Fresno Medical Education Program. She hails from a small coastal town in India where her medical schooling was at Manipal University in India. To meet her personal and professional goals in primary care, she started her DPC, My Happy Doctor, in San Diego, California in July of 2020, where through telemedicine and home visits, she is able to care for her patients. It is such an honor to have you guys back here on the podcast giving updates on your stories. And for those of you who heard this amazing group at the summit, and for those of you who have not, all of our guests today are going to be talking in more detail about what's happened over the past year. So I want to start off with the husband and wife team at Defiant DPC, Dr. Jake and Dr. Christina Mutch, who are about to welcome baby Mutch into the picture in just a few weeks. And so I would love for you guys to start us off with what has gone on in the past year at Defiant DPC so that you guys are adding more to the mix in your second year with a newborn in your lives.
Yeah, it has been a very eventful year. We are super excited. Our practice. We didn't know what was going to happen when we opened our doors in August of last year during a pandemic. And so this was, we were just blown away by the warm reception from the community, and things just really started to explode. And yeah, we're up to 152 patients, something like that. 156 patients in under a year. And that's well exceeded our goals. And we're just really grateful for the warm reception of the community. And we've got a little one coming at the end of September. So we're super excited.
Mm-hmm. So far, our patients have been very excited about that as well. Yeah. So they're not too concerned. Jake is going to cover for me. So thanks.
Yeah, I'll be
but yeah, we feel like we're at a really good point, and we've reached our goal about a month early because we wanted to get to 150 by our 1 year. And so we felt we're now in a place where we can chill for a little while we get this little one started, and then you keep going for the next year.
Christina, you mentioned that Jake's going to cover for you, which is awesome. And it's so convenient that you guys are in the same practice. But I want to ask you, what are some more details about your maternity leave that you've thought about and planned on? Because that's a big question for moms and families who are thinking about DPC or nervous to get pregnant because they're wondering, what am I going to do with my patients if I'm with a newborn?
Right. Yeah, no, absolutely. And it's definitely something I talked about. I had a lot of awesome DPCers that I was able to talk to too, that really helped, assuage some of my fears. And I think there's always a fear that, how it's going to be received. So far, the patients have been so excited and they're very understanding. And so that's been really reassuring. In terms of just logistics, we're fortunate enough to have a DPC about 25 minutes away. So he's been gracious enough to just offer to cover for us for the actual labor part, where Jake will hopefully also be by my side so he can get a couple of days off. And so that was a huge load off to know that there's that support there. And then in terms of trying to get my patients all situated before I leave, I've been working hard to get everybody in for their annual physicals. Since I'm leaving about a year in, people are going to be due for things. And so we're just trying to get people in a little, like a month or two early to get everything done and get everybody what they need, make sure they have all the refills, kind of, set them up so that 6 weeks is not too bad. And Jake can just be around for urgent things.
Yeah, I would say that one thing that we also wanted to set up was making sure that as the patients are continuing to sign up, that we have a buffer so that the coming months into the winter time are still not getting so busy that we can't set our priorities and make sure that we're taking care of the family. And so we wanted to make sure that we're also taking care of our patients. So one of the things that we did a couple of weeks ago was we set up a wait list for Christina. And so if people want to sign up with her, they still certainly can, but they can either go through the regular form for signing up and I can give them a call, or they can ultimately go to the wait list, and in a little while, we'll give them a call once we feel like everything's settled in a few months.
I would say DPC definitely gives us way more flexibility than a fee-for-service system. Yeah. And even though I may not have some of the benefits, which are minimal anyways in America, I feel like I can at least set my schedule. And so I know that I can space things out. He's probably not going to schedule any routine stuff for the first 2 weeks. So it's like he can just be for his patients for urgent stuff. So we have so much flexibility that we otherwise wouldn't have.
And even just thinking in that space of when you have had, like you said, 6 weeks. And when you start transitioning back, there's no hard rules there even. So are you going to do a little bit to just get your feet wet again? Or are you good? What's your plan when you go back to work, quote unquote?
Yeah. So definitely not set in stone yet, but just kind of been brainstorming. I feel like there's so many different ways. I could go back in office twice a week and do virtual twice a week, or Jake and I can stagger our appointment time so we can baby handoff in between patients. We're really fortunate to be 4 miles away from our parents. So it's, if I need my mom to come help, she can come to the office or I can drop her off. We'll be able to kind of play around with it based on what we need and be flexible.
Now, I want to ask about community events. So like Jake and Christina, you guys did the talk with the cardiologist. Deepti, you have regularly mentees who you talk to in undergrad as well as in residency. And then Lauren, you had this community event with regards to breastfeeding, and you paired up with, is it a breastfeeding coach in your community?
So I am the lactation consultant for one of the big doula agencies, OBabyKC. I've spoke at I don't know, a lot of conferences. I spoke at EHR conference a few weeks ago, the DPC Summit. I'm hosting a 5K for Happy Bottoms, which is a nonprofit organization in Kansas City that provides diapers free of charge to families in need. I am speaking at the Breastfeeding Summit, the local Breastfeeding Summit in Kansas City in September. I am hosting a how doulas can support breastfeeding moms in the first 24 to 48 hours in the hospital, because I think that's a really critical point. So teaching them how to best support those moms, how to advocate for them, what to watch out for. And then I'm also hosting a newborn education class for another doula agency called KC Women's Ministry that they do refugee and immigrant families. So they do a bunch of free doula care. So I'm doing that class for their clients at the end of August. And then I am talking with a physical therapist about hosting a mommy meet group where they can do free developmental assessments of PT, OT, and SLP would come and just do free developmental assessments for kids at the office.
That's incredible for your community because you are the only MD and IBCLC in the state of Kansas, which is amazing. So when you started, and looking back on all of the connections you've made with your patients and with your families and your community, how did you go about setting up those collaborations?
It was just networking is how it started. So I met Mary. She is the owner of Oh Baby KC. I started talking to her when I was an intern, and I had this idea and I knew who she was. And I was like, hey, you're a doula. What do you think about this? Or would people be interested? And at the time, her company was just her. And it has since it exploded. So she is they are now specifically just postpartum doulas, and they are booked out for the entirety of 2021 and over half of 2022. And they're this huge company. So that was just luck. And she just also happens to be an awesome human being. And our patient population is identical. So people that want my type of service want hers and vice versa. So it works out really well. We have very similar philosophies and that sort of thing. So it just makes it really easy. And then the other groups are just people that I've networked with either through other professionals or through social media, or I reached out and I said, hey, this is what I do. I'd love to have a cup of coffee. And so then it has just spiraled because Kansas City is a really big, small town. So everyone knows everyone, and there's couple million people, but it's someone who knows someone, and then it just takes off from there. So it's the, where you never shut up about your practice, and I'm really good at talking. So here I am.
Amazing. It's reminiscent of Dr. Anand Mehta, who said, tell 5 people about DPC and you never know how many people they're going to tell. So that networking is so valuable. And we all talk about it. It's that word of mouth that really gets people to understand what we're doing, because we're really going back to, and you guys have said this in conversations that I've had with you, as well as on interviews and whatnot, that we're really going back to the way medicine used to be, personable, individualized medicine. Yeah. So Deepti, now for you, with you setting up these groups where you are talking to mentees over time, it's not just a one-off thing with you. I love that you're doing that, because feeding the pipeline is so important for the whole movement, because at some point when, like Lauren's explaining, when Jake and Christina are explaining, you guys are growing way more than you thought you were going to in the time that you've had in DPC. If we're looking for partners, if we're looking for people to cover us on sick leave, vacation, how did you go about setting up these mentee groups in the up and coming folks' minds?
Thank you, Maria, for that question. So I really love teaching. And even though I don't consider myself really good at teaching, I just enjoy the process of teaching and just sharing, ideas and thoughts and listening to ideas and thoughts from the community. And pre-med students, I just stumbled upon it because there's an awesome psychologist friend of mine who was giving lectures or, kind of conducting sessions at the Scripps Ranch local high school and their pre-med club, at the pre-med club. And she just asked me if I'm interested in doing it. And then that's how I started off with the one at Scripps Ranch High School, which is in San Diego. And then there was a pre-health shadowing. It's a nonprofit run by students. I think it's worldwide. And some of them have seen me at the career counseling back in Fresno when I went to Fresno State University. Just to spread the word about medicine. I didn't even know about DPC back then. And so these were a few areas where I first started off. And then these pre-med students started reaching out to me via email. And then they said, oh, we like your presentation. Can you do more of this? We've been trying to get into shadowing, opportunities, but nothing's worked out because of COVID. I wasn't comfortable with full-on shadowing with, because it's new for me, my practice. I don't want my patients to feel like their privacy is being intruded right from the start, They haven't been familiar with me as much, right? My patients are new. I didn't want to do that, but I also didn't want to miss a chance of spreading the word, helping these budding doctors who are seeking out to get some sort of experience. So I started a virtual shadowing where I keep everything anonymous with each patient, but I go over the whole patient case and it's amazing. We always plan to do it for about an hour and it goes way beyond. Almost 2 hours sometimes, weekly on Thursdays or Fridays, depending on when people are free. I don't record them yet because sometimes it's extempore. I don't know. I don't always watch what I'm saying. And I'm still able to keep almost 10 pre-med students every week that show up, even though they have lots of exams and stuff that's going on. All of them can't make it all the time, but they try. Yeah. So that's been how I went about.
It's awesome. And for the listeners, Deepti, you even have somebody who's zooming in from Germany. That's incredible. Yeah.
It's like really late in the night for her, but yeah. So I'm actually planning something for her in particular because she wants a labor and delivery specific instructions and teaching based on those subjects. And my mom is OB-GYN back in India. She's been practicing 25 to 30 years almost. Our hospital back home is a small mom and pop style 23-bed hospital in a small town. So she has been running it as long as I've been alive. And she's invited to be a guest speaker for September.
How special.
So that's for my Germany med student. Because, yeah.
Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes. That's amazing. And Deepti, when you talked about that your quality of life has never been as good as it was since you were a kid, when you were at UCSF, Fresno, when you were doing your training, when you were dreaming about what life would look like, could you have ever imagined that life would be, I'm doing mentorship because I can, and I have a at-home practice because I can, and I'm doing telemedicine because I can. Can you just, I would love to just have your reflection on what you said in the beginning and what that really means in your day-to-day life now that you have your practice a year out.
So this question actually is so important, and I ask myself every day because I feel like sometimes I want to pinch myself and make sure it's really true. It's actually happening. So there was a few things I really loved about medicine. One, spending time with patients. And just like Christina said, that's key to have good satisfaction. You have a happy patient, you have a happy doctor. You can't work, one way. And so I think that was key. Second, I really didn't enjoy certain aspects, like the insurance aspect and how I couldn't get the medications patients needed just because I had to fill a bunch of forms and those things got lost because it's residency and you can't always keep track of stuff. You're in the ICU or you're, rotations that don't make it convenient for you to go and sign a bunch of papers and things like that. So that aspect. And then there was two other things. One, I wanted to continue my hobbies, like playing my keyboard, music, painting, things like that. And then the fourth one was something sort of concierge. Now I think about it, I wanted to be like that doctor who can go to people's homes and kind of get paid well too, meaning not decent enough that you can make a good end sort of thing. So it all blended in with DPC, honestly, where I don't feel like I'm overcharging. I feel like I'm making it affordable for everyone. At the same time, I get time for my home and family and my paintings and hobbies. It's just awesome. Too good to be true.
Love it. And for Jake and Christina, you guys shared, what's gonna happen in a few weeks now. You're gonna have a baby girl in your lives. But over the past year, I've seen you guys on your social media, you post your amazing trail hikes and what was the latest? You made a blueberry oatmeal parfait. And just the ability that you guys have to do these things. I would love for the audience to hear how DPC has affected your lifestyle in terms of you being able to be autonomous in your line of work, as well as how you've been able to do things you want to do in your lives.
I think too, it coincides with things that I finally get to do with my patients too. So like you said, I'm so passionate about lifestyle and nutrition and preventative health. And now I finally get to have the time to develop recipes and email my patients recipes. And eventually we hope to, maybe do some like cooking classes for patients and things like that, or even like some exercise classes once a week, or, something where you can really think outside the box. And it now blends like with your, personal life and your clinic, because you're just living your truth. That sounds so cheesy, but it's just, I feel like now our morals are also aligned with the way we practice medicine. And in the fee-for-service world, it was a constant fight against our morals, where we're doing things every day, like rushing people through a 5-minute visit and just feeling awful about it and not having any control over that. Whereas now I get to spend that time I want to. And then we also get to make time for things that aren't in the traditional system. And that makes it even more satisfying. And so you don't feel like you're working, you just feel like you're providing good care to the community and getting to do that in so many different avenues now.
When you take off the constraint of this needs to be a 5-minute visit in the office, then it's cool to see what you can do with either, technology or just what the patients are able to do in terms of shaping what their health will look like and getting a plan together. So I have some people who, they text me way more and we go back and forth talking about different health topics. Some people prefer phone or in person. And so we have all of those options available to us because we've got that availability, because a lot of the things that where you're in the fee-for-service world and you've got all these things that say you must be in clinic doing these things. Well, we can choose to, if we wanted to do like a walk with the doc kind of scenario, we can definitely set that up. We can spend a little bit more time developing recipes or making videos and showing people how to cook healthy and finally like tailoring what we do to their specific needs. And so that's been really liberating for us, because it's given us the chance to not just say a quick couple words about diet and exercise and really show them, hey, no, I'm going on the trail in the afternoon. This is the best place to go. Those kinds of things, they both really help us connect with patients and assure them that we're real people too. And health is important to us, and we want to make as easy to get access to from a health perspective in medicine, but also through lifestyle as well. And that's something we've really spent a lot of time talking about with our patients.
Practice what we preach.
Yeah.
Finally.
Yeah.
The fee-for-service system, we were going home at 8, 9, 10 o'clock at night and then come back at 7 o'clock in the morning because there was not enough time in the day. And so I felt almost like a hypocrite being like, oh my God, when am I going to fit in exercise and pack my meals? And now we can set up a balance where we can actually do those things for ourselves and then also teach people how to do them. So it's been, just refreshing.
I love it. It just makes me think of that saying, you can't take care of others if you don't take care of yourself. And when I heard that, I was like, I had to scratch my head a little bit, but it's not selfish at all. Like literally your guys' mission, all of ours as physicians, is taking care of other people. That's our calling. And we cannot do that if we are overextended, never ended. Yeah. So that's awesome. And Lauren, for you have twins and a 3-year-old who's almost, did he turn 4 already? Oh my gosh. Okay, yeah, that's because it's been a year. You're right. It has been a year. Oh my goodness.
Shook on it, and he told me that 4 is as old as he'll get. So we shook on it. So it's
I love it. I'm happy for you because I understand that they grow up too quickly. And for the people who have listened to Dr. Hughes talk on her podcast, there was lots of chiming in from the kids at the time. And so this is amazing. We get a kid-free interview. But how on earth could you have managed twins and a toddler in fee-for-service? When you look at your life and the fact that you are a solo doctor, how has that been for you in terms of you're still breastfeeding, you're able to take care of your family, you're able to see patients and take care of them? How is it all working for you?
So I've never been someone that likes to be bored. I don't like right now, like just sitting here talking, I'm going through records and I'm making a hand puppet mouth for my breastfeeding class. Like I'm like putting in record, like I can't do one thing at a time. Like I can't do it. That's not how my brain works. Like I have to be doing multiple things, likely undiagnosed ADHD. So I've always been someone that like, I do everything quick. I talk fast. I walk fast. I am like decide done and move on, trial by fire kind of person. And it's the same thing. Like, how does anyone parent? Like, you don't have a choice, right? Like these kids are my problem. You got to keep raising them. You have to feed them. You have to keep eating. So like, I have my computer open with a recipe and I have Spruce open and I'm like, I am able to shift my brain really quickly. Thank you, residency, that I can do one thing. And I'm like, okay, now add 2 eggs. Okay. Oh, you got this rash. That looks like Okay. Answer that. Now go back with I can just move back and forth really well. And usually there's a kid that I'm like tossing a frozen waffle to. And you just, I don't know, you just do it. Like, it's not a choice. The other problem that I have is I'm cheap and controlling. So I don't want to hire anyone because I know how I like to have things done. And I like, that's why did any of us start this? If I don't like how something's done, I'm going to do it myself. It's why we're all here. So I don't want to take the time to teach someone. I am a fantastic educator. I'm having my first med student. I'm a fantastic medical educator. I am terrible at personal things. Like if I want you to do it exactly how I'm doing it, and I don't want to take the time to go through it, and because then I am a trust but verify person. So it's just going to add the same amount of time for me to go back through and check it as to do it myself. And yeah, so I just do it. And I also, thank you, residency, and twins don't need a lot of sleep.
Oh my gosh. I love it. I love it. I hope that for anybody who may have young kids or like Christina, one on the way, it is so true. And if this is the life you choose to do DPC or to try DPC, then it will all work out some way or another. I will say that when we spoke, Lauren, for your interview, I was like, shucks, because I think I was 20, maybe 28, not too far off from where Christina is now with her pregnancy. And I thought about, after we talked, like, she is legit doing this with 2 babies and a toddler, and she's just making it work. So I hope that your words are and continue to be an inspiration to those who are worried about the balancing the children part. So it's awesome.
I will add a couple other things. Is one, I think it is important for my children to see that if you don't like how something's done, you can change it. You can do something different. You don't have to just do a 9 to 5 Monday through Friday and call it good. If you don't like it, do something about it. Put your money where your mouth is. So I think that's really important with what I'm doing. And I am putting in a lot of work now to be with them more in the future. Whereas if I was fee for service, it would only get worse. It wouldn't get better. And I get to include my kids. Like, my son went on a home visit with me the other day because I was like, hey, I text my patient. I was like, hey, I don't have an option but to bring my kid with me because we got swim lessons. So like, we're just going to swing by on the way home. And it was great. And he like actually got this toddler to drink who would refuse to drink for everyone. And he just walked up to her and handed her a cup and got her a drink. So like, he was an amazing nurse. So like, really incorporate. And I mean, my patients, they want pictures of my kids. I've gotten first birthday invitations. I get cake smash pictures. Like I get all this stuff because I think this is the hardest thing to wrap around your mind is you have a relationship, not a doctor-patient relationship, a personal connecting relationship, human to human with your patients. Like it is very different than traditional practice. So they like Christina said, like I guarantee all of them are truly thrilled for her. No one's, what about me? No, that's not how it is.
Yeah.
And I think that's what everyone's scared of because that's what fee-for-service is. So you can have the balance and you actually have a better lifestyle because you're happy, which is the most important thing for your kids, is that you're a happy parent and like you're doing the right thing, which I think it's good to teach your kid ethics. Like, so it's very doable.
Lauren, when you talk about this idea of that your kids are seeing, if you don't like something, change it. I want to stay in that space for a few moments because I'd love for each of you guys to share what in this past year has been one of your biggest challenges that you said, nope, I don't like this, and this is how I'm going to change it.
Ooh.
Stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad.
Our local children's hospital was bought by someone new, and they have shifted more to a mid-level first assessment and then transition to physician if needed. I inherited a patient who was seeing a mid-level in neurology virtually for 6 months and did not have a diagnosis. And I had to fight a ridiculous fight to get this patient, one, seen in person, and two, by an MDDO. And she had a relatively devastating diagnosis that was being completely overlooked. Then I also complained to them because they had a 2.5-year-old autism evaluation virtually scheduled. And I was like, once again, this is not appropriate. So that has probably been my biggest win, is that I actually do feel like I am making a difference in this pediatric hospital, because if these complaints were just coming from their own system, they don't listen to them. But as a referring doctor, and I am someone that is going to bring you patients, bring you money, and I'm very loud, they respond better to that. And I have also encouraged my patients to reach out to patient advocacy and also be very loud, especially with this pretty much medical neglect of my patient with her awful diagnosis. And I told them, I said, I've encouraged my patient to go public about the errors done here. So I hope that they actually will make the changes, because what's going on right now is money over patients, which is the entire system.
I think you bring up a good point that you have time to be an advocate now, right? Before, when you're seeing 30 patients a day and it's go, you don't have time to pick up the phone and make sure that your patients are getting the care they need. And I feel like now in this system, it's like you have the time to go and yell at people and to advocate. And I've been on the phone with my patients at their specialist appointment before to make sure that they got their questions answered and the questions I had answered because they were being ignored or rushed through, and being like, actually, I'm actually here. And they're like flabbergasted that they're like calling their PCP in the room. So it's refreshing that DPC, allows for that advocacy. And I tell patients that's my number one job as their PCP, is that I'm their advocate. Because unfortunately, you need one in the system.
So that actually reminds me of one of my newest patients from last week. She's 92 years old, and her granddaughter is her caretaker. And the granddaughter was trying to get in touch with the primary care doctor to just talk through stuff, because grandma is having short-term memory loss. So she's not able to tell her all the symptoms. So granddaughter is actually watching what's happening, and she registers, obviously, and is going to, kind of share useful information with the primary care doctor about, that joint hurts her the most. That's where she limps, and such useful information. So what happened was this granddaughter actually reached out to the primary care doctor in the fee-for-service model, who said, no, I don't want to talk to anyone other than the patient. Which I don't know if they got busy and they didn't know it was a 92-year-old patient. That's what happens when you have God knows how many patients on your panel, and they're switching physicians often because one is on vacation, and then you cover the other persons, and then it's 5,000 patients that are on your panel for that time when your colleague is on vacation. So she reached out actually on Facebook on a common group, because I'm in the local group for, our neighborhood. And she just wrote, is there someone who cares for Medicare patients? And then there's always all these fee-for-service doctors that are mentioned by people in the community because that's who they go to. And then it was only me who actually was the doctor who wrote in there saying, but I'm happy to take care of grandma. And this is how I've worked in the VA before and things like that. I'm pretty familiar with geriatric patients. And so let me know, message me, and we can get started. And she reached out, and since then, it's been just so awesome. I've gone to her home. I sat down with grandma, and grandma said, where have you been for so long? Isn't that crazy? It really is someone who's 92 and still believed in a model like this. And she finally got to see it. She probably doesn't even remember me because she has short-term memory loss, but it was just such a special moment. And that's patient advocacy. For the past week since I've had her, I've had multiple phone calls with all the specialists she sees. And the pain specialist was new because it was a new referral. I already informed him that she's going to come by. So at least he's prepared about what we're looking for, what help we're looking for. And it's just amazing. This is what I'm talking about. Time is just awesome to have that time.
If anybody has been on the opposite side, as we've all been patients at some point in our lives, and then when you get to provide the care that you wish that everybody had, it's quite stark the difference that we see in a fee-for-service world versus in DPC. So that's amazing that you guys you're doing it. With regards to things that you've changed, I want to ask about workflows. Two of you use the same EMR, and one of you uses a different one. You guys, none of you started out with staff. And looking at your workflows over the past year, could you guys walk us through a little bit about what happens when a patient joins your practice or when a patient's interested in your practice? And what is one thing that you might have changed?
I would say that we spent a lot of time thinking about workflow. And when we first started, when you first open the doors, you don't know what's going to happen or what's going to be needed. And so a lot of this was rolling with the punches. And so we did a lot of things on paper to start with, and that were not quite as streamlined as we'd hoped to. But we had the time at that point to reinvest in scanning the documents and putting them into the EMR and just the general onboarding or records release processes that tended to be done with wet ink. We eventually got to the point where, as we were onboarding patients through towards the fall of last year, we were, so grateful to have a good response. And ultimately, we realized that we were going to need to find ways to streamline our workflow, to make it a little bit more efficient. That way, we could actually be available for patients when they need us. We can respond to how the day is going, as opposed to having paperwork and other things to worry about. And so we spent a lot of time thinking about that. And ultimately, we tried to go back and figure out what's the simplest way for this to be done. Is this a way that like the agreements can be put into the computer or sent before the first patient visit, that everything can be signed and just ready to go, as opposed to doing everything in the room and answering questions there? And we found that was a little bit more efficient as well. But at some point we found that there was this critical mass where it looked like, in order to help us spend our time talking to patients, marketing the practice, as well as spending time caring for patients and being available, we ultimately were thinking about bringing on some additional help. And we were so grateful to have a nurse that we worked with during our residency who was she had transitioned out of that job and was about to move and looking to do other things. And she was open to doing something that was a little bit more flexible for her. And so we ended up using a couple of different methods to make that training period a lot smoother. So we tried to figure out exactly what was the smoothest way to do each task, but then we thought a step before that, how can we make the onboarding process for employees or new hires or anybody who's coming onto our team, make that smoother for the future as well, and investing that time. So one of the things that we ultimately did was we created I guess on the MacBook Air, it's like Command Shift 5, but basically we recorded a lot of videos of how to do tasks in the EMR and then uploaded them into our kind of secure Google Drive. That way she knew exactly what the workflow would look like. It was almost as if we were over her shoulder. And then the other benefit from it was that if our team decides to grow in the future, then all of that time invested can also be reallocated to anybody who comes on. So it saves time in that way, and also helps us realize if something is immediately not clear when it was in our heads. And then we say it out loud and we say, okay, maybe we need to find the best way to do this. And I think that's really helped in these past 6 months or so.
And to your question of what would we change in the beginning, I don't know that we necessarily would, because I think your needs change as you evolve. And the beauty of it is that you are the captain of your own ship. So you just change it. So if something's not working or there's a pain point, you say, how do we make this easier? How do we make this more efficient? And it might have been efficient in the beginning, but as your patient panel grows, it becomes inefficient. And so being able to adapt and do things quickly and not have to go up the chain of command and be like, can we please do this grooming process different? No, you just change it. You change it the very next time you do it. And so that's been key.
You're developing what other people would refer to as a wiki. If people are not sure about how to create a learning platform for others to learn off of, MemberVault offers a free place to develop courses that you can use to train staff and whatnot. Up to the first 100 quote unquote users, it's free. And that allows people to do things like not only something for your own staff, if you're wanting to go into the space of teaching other people, like your patients, about a certain thing, like a breastfeeding technique or whatever, you can develop a class and trial it for free to see if people are interested before paying for it. Unlike other Skillshare type platforms where you're going to have to pay from the get-go, that's one option in addition to just creating your own YouTube videos where you can create education bases for your staff and your patients. So I'm glad that you brought that up. Deepti, how about when you look at your workflow, how has it gone over the past year? And if you knew what you knew now, what would you, if anything, have changed?
I would have definitely done the free video meet and greet. I think I mentioned this to you before. I should have done that before, because from what I've seen, and the biggest challenge in my community, most people just like the traditional insurance-based model. And either they haven't used it enough to know that there's going to be a deductible they have to pay and there's going to be co-pays. They either haven't used it enough, or they're just too skeptical of something new like DPC. Like, what the heck? Is this even real? Is this legal? Right? And I've realized that my biggest challenge has been education awareness about DPC. And I know that it's gone a long way, definitely, because I did a cultural event participation long time ago when I just thought about DPC. I didn't even start my practice, but I just went in and spoke. I knew my name would be My Happy Talker, but that's all I knew. And so I spoke at that event, and last week I got a patient from someone who it passed the word about me from back then. So talking to people has really, like Lauren said, has really helped with because that's my workflow, is to get the patients in, right, into my door. After that, there's always going to be extra, the rest of the workflow. But marketing and getting your patients into your door has also been a sort of workflow that I had to work with. And so free video meet and greet, definitely, because I did used to do mostly phone calls. And I remember a patient saying, hey, can we do a video? And I was like, I thought it was going to be a lot of my time spent on something where I could be doing something else. But now I realize, even if the patient doesn't sign up, they've heard, they've seen, they've felt what it's like to talk to me. And then they'll go tell others who might need something like this. And so that's been awesome. And the second, I just like Christina said, you need to make mistakes to realize what might be a better sort of workflow. So having that agreement and all those things, like coming along before you actually start your first appointment, your welcome email, housekeeping stuff, and what time you work, and who the psychiatrist is, suicide helpline, and all those things. You build the welcome email over time. You add more stuff to it, and even the agreement, you make changes over time if you change your pricing and stuff. So it really, I think, is something that develops just, like a personality over time, your workflow.
Lauren, how about for you? How has your workflow developed over time?
It developed because I didn't have one at the beginning. Like I said, I am a jump into it. So I was like, yeah, I'll figure it out as I go. I did not think of, well, how can I do this better? How I'll record it. I probably just got a good workflow like in the last month. How that went about was like, I was like, this sucks. So I feel like, okay, what's my biggest issue? And my biggest issue is staying on task and remembering things. So like I've now set up a to-do list, and it makes a nice ding whenever I get stuff done. And so like I was realizing that I'd do meet and greets and I'd forget about contacting people. And so I was like, oh, that's probably not good. And so now I have like a meet and greet list, and like I leave myself notes. I'm like, this was this person. This was how I felt about them. Like I followed up this day. They haven't responded. So I can like leave myself notes. I remember who everyone is. And then people love it whenever they reach out, because I'm like, oh, you're about what, 38 weeks? And they're like, oh my God. And then I have like my new patients and my workflow, and okay, I've done everything. Now I can just be their doctor. And I have a lot of my EMR is great because it does like automations for like so like I see at their 2-month, okay, automatic send an email 2 weeks before their 4-month is due to schedule that. So like I have that reminder. So like, I didn't know how to do that. So like learning about that, try to come up with some sort of process in the beginning would probably be my biggest thing that I would have changed. And then, yeah, my website changed. So initially how I had it, I realized how I had it was for me and not for someone that didn't know about direct primary care or what my practice was. And like someone looked at it and they're like, there's no call to action. So I went through and I revamped it and changed it to be like in your face. And it was a positive response. At the beginning was like, I created something that I thought was great. I didn't look at it from a potential patient other than, oh, it's pretty. The other thing is that probably only 10% of the people that call me have looked at my website. Most of them look at my Instagram. So another mistake I made was my social media at the beginning. I was like, oh, I'll be this like educational pediatrician. That's not what people want. So my website is what you need to look at it as who your potential patient is. Your Instagram and your Facebook needs to be like targeted to me because I'm my target market in social media, because that's where most of my patients are finding me. And so I wanted them to be able to look at my social media and be like, oh, okay, yeah, I get not only who she is as a person, but what the practice is. And because honestly, it's where most of my patients have found me is either Instagram or word of mouth. So I would have started that sooner. And the last thing I would have done was actually research phone options. I started with just Spruce, and I did my clinic number and my patient number through that. As you can guess, my ADHD does not allow me to remember what number I am contacting people from. So I gave everyone out my private patient number. So I was like, okay, I need something separate. So I did Google. I don't know what my deal was with Google Voice, but I was like, no, this isn't good. So I ported it back out to Spruce. Then I was like, no, this was not a good idea. So then I ported it out to RingRx. And then RingRx was terrible. And so now I ported it back out to Google Voice.
Google Voice is fine.
No, I paid so much porting fees because now I'm stuck with the same number. So I would say, don't just do things on a whim. I do not get decision paralysis, but I like stopping to think before you decide on a program's probably. I didn't look at any other EMRs. I just saw mine. I was like, oh, this seems fine. And then moved. And I was like, done, go. I'm at, what am I at now? Like I just enrolled someone else, 105.
Look at that. That's awesome. You can always, you are what makes the practice special. So everything else will revolve around you.
Yeah. Everyone knows I'm scatterbrained.
You're doing awesome.
That said, I have to say, in terms of scatterbrain and like the task list, I think my favorite find this year was Trello. No disclaimer, unless they want to pay me, but I do sticky notes. So in the beginning, it was just sticky notes everywhere. And that was not good. They lose their stickiness and then you lose your task. And so Trello board is like a virtual sticky note and you can click on it and then there's a backside to it. So you can put like more details and then you can have different rows. So you can be like administrative tasks, home tasks, clinical tasks, or like waiting on. So it's like when I finished my clinical task, but I was waiting for the patient to get back to me, I could move it and no patient identifiers, just I would remember what I was thinking. Or like in the beginning when we didn't have a bridge with our lab company, I would put labs to follow up on just to make sure I got the results and things like that. So it was really useful for just my brain and how I think to keep track of everything, since you are wearing so many hats. Your admin, your clinical, your business, and then your personal business. And so just being able to portion those out so I could keep track and not spend too much time on one thing too. So I realized that I would put off all the admin tasks and do the clinical, but I was like, okay, each day I need to do at least one admin task. So that was helping me keep a track of everything.
Yeah. And Todoist is another example of one of those web-based platforms like Trello. There's a million of them out there, and that whole system of dragging and dropping things along columns based on how they're completed or what you're waiting back to hear, and a different role for each project board. That I think has been really quite helpful in terms of keeping us organized, also letting us know what tasks were on our mind that we need to delegate later and following up with those. So that's very much has helped us sleep at night knowing that everything is in one place.
Does it sync with Google Calendar or some sort of calendar or not really? It's a
good point. I think Todoist might actually sync, but I would have to check on that. I'm not the authority.
Mine is Microsoft to-do list, and I like it because I have a Mac and an iPhone, and so I can add to it from either place. So if I'm like, because I am like I thought of something like while I'm like walking down the stairs, and so I can add it there, and I like it's down and done.
Yeah.
Mm-hmm. Yeah, same with Trello.
Some sort of quick capture.
Mm-hmm. Especially in the middle of the night when I'm like, oh my God.
I wake up at 2 a.m. and I'm like, I never followed up on that lab.
Mm-hmm. For the listeners who might be looking to keep their overhead low, options like the Kanban boards like Trello are free. And I believe on Trello, you can have up to 10 boards. So it's great things that, like Lauren's mentioning, if you are thinking about something before jumping in and doing it, having the usage of the free trials could really help some people if they're trying to keep their overhead low.
Yeah. Yeah, we took a long time trying to find what we wanted to use for e-signatures and forms and faxing. And so I think we tried 3 or 4 different trials before we found one that worked for us. And even if you go on the DPC Facebook group, everybody likes a different one. So I think, Lauren, you really intake IQ, like it did not work with my brain. I couldn't do it. What's that?
Use Jot forms because they did.
Jot forms. Yeah.
I signed up during the pandemic and it's free for the HIPAA compliant ones. So
nice.
Yeah, no, so that's awesome. So there's so many options out there. So yeah, I think those free trials are huge because you can play around with it and see what works.
Yeah.
So when you guys have changed things in your practices and in your workflows, what are some of the reactions that you get from your patients if you have to tell them like, hey, we're actually going to, resend something or send something a different way next time? What are some of the reactions? Because for those of the listeners who might be a little bit hesitant to do changes because they don't want to rock the boat, so to speak, how have your guys' patients reacted?
Yeah, there's one that particularly comes to mind that was a bit of a sore spot for me. When we first started the practice, we were getting PDFs and sticky notes and all these different things from a bunch of imaging providers that we had said, hey, can you just send us what your cash prices are? We're trying to offer this to patients. And so when somebody first needed an imaging study and we're talking to that patient, we, after the visit, would go and think about, okay, which imaging center would be best and how, I've got to look through all of these sticky notes to find the best price for this specific thing and calling it confirmation. It was a whole thing. And one of the things that we wanted to do was develop some sort of systematic search database so that anytime somebody is within a certain mileage, or they want to avoid this hospital system, or they want these specific characteristics, we could just enter those into a database and have the best imaging facility at the cheapest price pop up. And then we could counsel them like, this is where you should go for this, and I'll put the order in. That took a while to develop. And what we found when we started compiling that, first of all, we used Notion, Notion.so or something. It's completely free. And that was really extremely helpful. One thing that we would notice is that now that we had everything organized, sometimes an imaging facility, the quote that we had may not have been the one that they were telling patients, or there were little nuances there. And so we were able to update that and continually update it based on the feedback that we're getting from patients. So if they say, you know what, I get that this was the cheapest price, but doc, I just want to tell you, this wasn't the best experience that I've ever had at this facility, or they were totally blown away and had a great experience somewhere, we make little notes about that. And then that informs our decisions for future patients when we're deciding how to prioritize which imaging center a person should go to.
And for Lauren and Deepti, in terms of if you've changed something, how have your patients reacted to it?
I'm sure you can imagine that this is about how I am with patients. I'm like, hey, I was pretty dumb with this and I didn't know how it worked. So can you just do it again? They're usually great. I've had anyone be mad at me, or I'm like, hey, can I a guinea pig? And I'm going to try this and tell me if it works. And people are thrilled to be in at the start of something. They love help. And there's something about being vulnerable as a doctor where you're seen as this impenetrable force. That's what people have in their mindset of what a doctor is. And whenever they realize, no, you're just an actual human who screws up or is trying to figure things out. People love helping. So I'm like, hey, let's see what happens. And if we get in trouble, that if someone calls in is mad, let me know.
And I think in that same talking, being that honest with people and just being like, oh, this did not work, or, oh, sorry that this X, Y, or Z got messed up. They're just, oh my God, no worries. Thanks so much for letting me know. They're so grateful that you were super honest about it. And because I think that's new and refreshing for them. And once they find out, they're like, wait, you're doing everything? And we're like, oh yeah, we're doing everything. They're like, oh my gosh. And they have so much sympathy because they understand that you're trying to do so many things at once and not just the clinical stuff. So they're very patient. And I think,
follow that. It really does inform our workflow a little bit. When I think the one that really sticks out to me is when you fax a prescription in and the pharmacy says that you never sent the order. And then you're like, no, I can definitely see it. It's in the EMR. We also have a feature that allows our patient to get a copy of the order and an auto text when we send that fax button. And so that feature has been quite nice in informing discussions with the pharmacy.
Exactly. And your patients are like, I know you said this 3 times, but they still have not found it.
I think that's common.
The patient knows. So they'll go to imaging facility and be like, oh, we never got this. And they're like, no, you did. And they're our advocate. So it's absolutely great. And they realize that it's not our fault. And
That's awesome. I've actually had my patients call me. I specifically instruct them to call the pharmacy before they go and then call me from the pharmacy, no matter what time of the day it is, just call me, because I really think it's rude to send them back because they didn't have an order or something. And I would rather just give a verbal if worse come worse. Yeah. People have busy lives and it's so not fair to. So that's a great point, actually, Christina. They know we did it. They know we did it.
And then you get this wow factor because the pharmacist is, wait, you got hold of your doctor at 5:30 on their cell phone? and it's texting. And I swear I've nearly gotten a referral that way. One of my patients' pharmacists was like, wait, are they taking patients? Blown away.
Because they had to give my patient their Gardasil shot and they were like, oh, she didn't specify that we could administer it. So they text me and I sent the new one in 20 seconds. And they were like, wait, they sent it?
Yeah. I was on vacation one time and it wasn't like a big vacation that I announced to all my patients because I was able to do stuff remotely anyway. So I got a call from this patient and I missed it because I was playing with the doggy or something. And then I looked at my phone and she said, oh, they say they don't have the mammogram request or they want the older mammogram report or something like that. And so thankfully, I had actually on my Atlas MD, on my left-hand side, I have health history. And I had actually tagged the page number on all the health records that were sent to me. So I know which page had the mammogram. And so I could just send her just that one page. And she got it right away. And they were surprised because they're like, wow, your doctor just sent it like right now. And she got everything done. I've noticed a lot of times where medical records departments don't want to send records right away. They'll say, when are you going to see the patient? Right now. Like, why does that have to be a reason for your delay? Why does my visit from next week give you the liberty to send it next week? And then they have excuses, right? They'll say, oh, but there's a process, doctor. And then when there's a process, then I just tell them, I'll hang on here. I'll be on hold. And I do small talk. It's so funny. One day I was like, oh, how is COVID with you guys? And how is work? And then they know that I'm not budging. I'll call again if they hang up. So
Plus, the actual doctors calling for medical records, that usually flabbergasts them enough. And I'm like, hey, you can wait. I'll see if I'll wait until the fax comes through. Or like, I'm going to wait on hold. Can you tell me if the fax goes through? And I had one person be like, oh, I don't think it's that instant. I'm like, it is. I wait. And they're like, oh, it's coming. And I'm like, yep, that's how faxes work.
That's how the patients love it. Patients love this. So I think when I wrote one wrong date of birth, I wrote the enrollment date instead of the date of birth. And I sent it. And then I realized like within a second, and I told her, oh, sorry, so-and-so patient. And she's, oh, wow, that would have been nice. I would have been 18 days old if she joined me. And so they take it so nicely, because you're having their back on all these other complicated times.
I just think about the different EMRs that we have accessible to us because we don't have to use what the fee-for-service employer makes us use. Just the idea of having integrated faxes or streamlined faxes. I shared my plans with my EMR with one of my coworkers who works the front office desk. And she was like, wait, so there's no paper? It actually goes directly into the EMR. And I'm like, yeah. So it's pretty incredible, the tools that we are able to use. So I want to ask on that note, what are some of the favorite pieces of tech that you guys have found over the past year that you use in your practices?
Yeah, I think that we're currently experimenting with a lot of them right now. And compared to typical fee-for-service, I'm really excited about this actually, compared to the fee-for-service world where you can imagine an EKG machine being this like $4,000 thing that you like cart in between rooms, like anything off the trolley gears. So this is definitely different. And I have experimented with a lot of them. For the 12 lead, we use a smart heart EKG. It looks like a heart monitor that wraps around. It's a full 12 lead, but instead of the sticky leads, you can put it like there's a metal electrode putting like under the armpits. And so there's nothing to rip off somebody's chest before. So it saves a lot of time if you need to get a 12 lead. We're actually experimenting right now with a CardioMobile 6L, which is essentially it's like the size. I'm so excited about this nerd down here. So it's like the size of a stick of gum or so, but it's a 6-lead EKG where you just put it over your knee and thumbs on either side. So there's 3 electrodes. So you get all 6 leads there in case like irregular heartbeat or something like that. And it takes like 30 seconds. You can just like straight up just hand it right to the patient. And that kind of stuff is it's fantastic. And we loved it. We've got a dermatoscope now as well. We've got a derm light carbon. And that has really been, I think, a game changer for me personally, like being able to counsel patients on, okay, does this need to be biopsied? Is this something we can watch and wait on? It really clarifies a lot of those questions that normally would just be something that you say, we'll try an empiric like therapy or we'll watch and wait. And it really helps answer a lot of questions in advance. And you can leverage that to help reassure patients when it's appropriate and get them to a biopsy if you don't. And so that and the butterfly IQ, we awesome. Use that for bladder.
Butterfly IQ is awesome. I went in one time with a patient having a lump on his back, and I went with the IQ and I look at it. Oh, it's squishy. Oh, it's lipoma. It's so funny that you can actually take a look at it and know that there's no like connection to something else inside.
Yeah, it's so true. You can do things with that reassurance. I had a person that thought they had a cellulitis, and from the picture it looked that way. And I brought her in and I heard her story, and I was like, I don't know, let's ultrasound this. She had a hematoma from her fall, and so it was like this was not a cellulitis. And so it really it's helpful to have those extra technologies capabilities there and be able to, again, adapt, because we really liked our EKG machine, but we're like, man, we really don't need this when we just need a rhythm strip. We need something even quicker, and being able to find something else. That's been fun. In terms of like electronic stuff on the computer, we've liked HelloFax, HelloSign, just because it's all integrated in one. We're able to do it all from one thing. And
I'd say my coolest new addition is I make a nipple salve that I'm very proud of. I had a mom text me. I grew new skin in 6 hours. So that works really well. That's $10 for 2 ounces. So it's half the price of most places, because usually it's $10 for 1 ounce. And and it's actually really fun because my sister-in-law has the herbs that I use. A friend of mine raises bees, so I get beeswax from her.
Oh, cool.
Her daughter, her 7-year-old, wanted to start a business, so she milks their goats and sells me the goat's milk for the soap.
My God.
It's
like a storybook.
Yeah, it's really cute. And then, Christina, what'd you say? You said
some of the rooming stuff, because I feel like in a lot of the scales and the height meters and stuff like that can get so expensive, but there has to be like good hacks.
And I'm totally going to throw this in there because I need to know this, but like, what do you do for your vaccines and traveling with vaccines?
I was just going to say,
okay.
So I found a travel insulin fridge that works amazing. So I have a Govee thermometer cube. It's a travel
too. That's awesome.
So I put that in my little, it was like $120 insulin cooler. And I did test runs with it, and it stayed at temperature for 4 hours unplugged. So I don't leave it unplugged that long, but like I put my vaccines in there, so it's enough to hold a full set of shots. So like for a 2-month or whatever, and you have 2, 4, 6, 8 things that I take, it holds all of it, lays flat, seals. I throw it in my bag. I did get a really nice leather like carrying bag open at the top, so I can take all my stuff in. I bought second sets of everything for home visits because I was tired of having to pack up every single day and have to look at my calendar. And then it's inevitable that someone's got something going on the night before. And so I'm like, oh God, okay, now I have to go back to office and get this. So I have second sets of stuff, and it was actually really helpful. Like I keep it in my car. My son has strep, so I was able to just swab him real quick at home because I keep it in the car. And so the insulin fridge has been awesome for traveling with vaccines. And then Facebook Marketplace is my jam. I found a guy that goes to medical supply sales. And so I got a full-size travel stadiometer for $60, and it like breaks apart. And I got this like rolling makeup cart from Amazon, and it opens at the top. So like whenever I have to take, if I have a 3 and up visit and I have to take my stadiometer and my blood pressure cuff and like my Snellen and all of my extra stuff, I have this nice cart, and it fits perfectly in there, and I can throw my audiometer in there. And so then I don't have to like carry all this stuff. I just have this rolling bag. So that has been really nice. Keeping pens everywhere. It's really nice.
Yes.
I don't know. I think, then I started this little retail section because I do lactation consultations, and so many times like I'm like, oh yeah, baby's got cradle cap, do this. And I'm like, oh, a lot of my patients are home birth, and so they don't get the white hospital brush. So I'm like, I don't have anything. And so I was like, okay, I'm tired of sending people to go get things. So I just started stocking like the most common things that I recommend. So like I'm a Frida cult member. So like I have all the Frida products, the milk supplements I recommend, then like my nipple salve, the humidifiers, and then just some like cute things like some pacifiers and diaper bags. And then I really like this. I try to be plastic free. And so I really like this laundry detergent. So I started carrying that because it's zero plastic. Yeah. And that is fun too. And I do ear piercings, and that's really fun. I get to do like, kids come in on their birthdays, and I do like little ear piercings, and I've gotten some patients that way because they're like, oh, I wanted a doctor to do my piercing. People pay insane amount of money to come to their house to pierce their kids' ears, like insane amount that I would never pay for an ear piercing. Yeah.
And Lauren, I just want to follow up on you mentioning this little boutique that you have. Do you have a resale license for that? And then do you sell it because you have a second location with inside of a...
No, I don't have enough to do. So it's pointless it's just based on the geography of the metro. So a bunch of my families are south. So I kind of fell into this wellness collective that I did not intend on joining, but I just adored the owners so much. And they were like, no, you should just come here. And enough of my families live down south that it was a convenience for them. So I go down there on Mondays. I don't have any of my retail stuff there, but I tell patients, if I see you there, you can just text me and I'll bring it. But they are carrying my nipple salve and soap and selling it out of their storefront. And they just buy from me wholesale.
Awesome. And then for your boutique part at your regular Bloom location,
I have a resale license. That's really easy to do. You submit taxes once a year. My EMR and Square keep track of my taxes. So that's super simple to put in. The hardest thing I think was finding what percentage of tax to apply. Because like I had to do Kansas state tax, Kansas city tax, and Wyandotte County sales tax. So there's several I didn't know that I had to do a city tax and a county tax. I thought it was just the county and the state. So like just Googling it isn't that helpful. And I called the government and asked, am I legal here? That's why the only people I pay money to are a lawyer and an accountant. They don't want to go to jail.
And Deepti, how about you in terms of tech that you
tech? So I do have the Butterfly IQ, and then I also have the Cardiomobile 6 lead from the start. And then I've always thought about all these others, the spirometry one, Nuvo Air. I already spoke with them, but I'm then thinking that I'm getting ahead of myself a lot. All right. We can always buy those. And then I have the Eco stethoscope, which really helps actually, because I don't know if it's my ears or the environment that I'm in when I'm always, I'm like, oh man, this is awkward. Now I'm like waiting for too long to listen to this heart sound. So the 40% amplification in sound really helps me. And it's super easy. I pull out my phone. I just open the Eco app. I have my, earbuds in my ear, and then it connects immediately, even if I've not used the app for a long time. And then I also have an otoscope, which has its own app, and it was only like $15 or $20, that otoscope. You just put the ear tip, hold it in there, open that app. I think it works via Wi-Fi. It's so funny. It's not even Bluetooth, but it's like you find it on your Wi-Fi for some reason. They have a workaround, I think, instead of using Bluetooth, and you can see the image right away. And so, ear back, whatnot, tympanic membrane, everything. So these are in my Johns Hopkins medical bag with all of these, and then on my outside pocket, I have some gloves, sterile gloves inside. And then I carry a bunch of extra masks. I have my Cardiomobile with me all the time, because I feel like it's totally worth it, because it barely takes 30 seconds to take that. And then worst case, if it's a patient who's just not able to hold it steady on the knee or on the ankle, I still get a single lead with that. So it's still easy. And I can download the PDF immediately and have it sent to the patient with a password protected link. So they love it. They love it. And in fact, one of my patients, I think it's a COVID, he had COVID before, and now he's having a lot of palpitations, which despite treating anxiety, it seems like there might be something going on with COVID-related arrhythmias, which we obviously don't know enough about. I don't know if it's inappropriate sinus tachy. And so he actually went ahead and bought the Cardiomobile $99 one. And it's awesome, because I feel even if I were to loan it or something, it's not prohibitively expensive. He can... $99 is like dinner at a restaurant in a nice place. It's going to be a single investment that he can watch his heart. But there's always patients who will freak out if they see something. So you've got to educate and train them to not freak out if they see something.
Thank you guys so much for sharing the continuation of your journey into DPC. As we close the interview, I want to ask you guys, what are some sage words of wisdom that you can share with the listeners as they explore their own DPC world?
Okay, I'll go first. There's a million ways to do this. And just because somebody's doing it one way or using one platform or is setting up their practice in a certain way doesn't mean that's how yours needs to be. And the beautiful thing about DPC is that you get to think outside the box and you get to reinvent the wheel, and you don't have to go by the traditional rules. And so question everything. Why do we do it this way? Do I need to do this? Do I need to buy this? And that really opens up doors to let you tailor it and really make it your own. And that's really what patients are coming for. They're coming for you and how you set up the practice, because it becomes a very personal creation.
Yeah, to echo off that, I don't know if this was Steve Jobs or I'm going to butcher this quote, but there was something along the lines that really struck with me one day, which was the vast majority of what around you was created by somebody who's just as intelligent as you are. And so it's really, sometimes it can feel a little bit paralyzing when you first start a practice. There's so many different things to keep track of, and you can feel a little bit intimidated by that. And then ultimately, what we've discovered is we've taken like baby steps each month to trying something out or experimenting with tech, or what if we did things this way? There's the time to do it and the freedom to be able to say, okay, this worked really well. Let's continue doing this type of workflow. Whereas some other things we say, okay, let's back off and let's do it a different way or go back to the old way. All of these things are because you're the captain of the ship for your practice, and you get to make those decisions and figure out what's best for your patients and your community and get them the resources. You get to be a doctor again. You get to be a patient advocate. And so if that's something that really resonates with you, of doing little bets and little experiments to try to find the best way to do your style of healthcare best, then DPC is definitely the way to go for it.
Love it. And Lauren?
Mine would be a couple is one, not to compare. Your practice is yours. And some of the best advice I got was one, do not create anything on jealousy. Your business will not thrive if your goal is to beat someone else. Yeah. That like no one else's success affects yours and no one else's failure affects yours. That's not how business works. Your people find you. And if they start seeing someone else, they don't join. They're not, your patients find you. And when your people find you, they are loyal. So being patient, which is really hard to do. And because whenever you are waiting for that like windfall of patience, it's terrifying and it feels like you're failing. And if you have kids, several times I would break down. I was like, what the hell am I doing? I have 3 children and I don't have an income. What am I doing? And so getting through those like really crappy times and not looking around being like, this person's doing this, maybe I should try that. No, because that's not genuine. Like when you start being genuine, your people find you. And just do everything you can to like only focus on that and not anyone else.
Yeah. Awesome.
And for me, it's stay positive, because we come through training in a system that's really focused a lot on negatives, and everything is, the bottom line is so different from what our bottom line is: happiness and good quality care and no nonsense, #no nonsense. And so I think for me, the biggest advice I can give is to really focus on the final outcome. Have long-term goals and then have short-term goals. So long-term goal is to have an amazing practice with so many patients and doing what you love. And that could be certain procedures, or it could be just enjoying aspects of internal medicine, like training your patients to detect stuff when there's heart failure, things like that. So really spending the time on doing what you love ultimately has to be the long-term goal. But the short-term goal of like how many patients you want to have, and if you don't have that many patients, you don't want to be upset, like Lauren said. You want to focus on how else you can try and make pound the pavement and make the practice really visible to the community. So short-term goals, long-term goals, don't confuse them, because if you try and get the long-term goals in a short term, you're going to be disappointed. Things take time. And then the big one is good, cheap, and best, right? So this is a good model. It's cheap because you don't have a high overhead. And it's not the best, it's fast. It's not fast when it grows, because DPC is so awesome. And I think we grow fast as well. But generally, most businesses are either good, 2 of the 3, good, cheap, and fast.
Thank you guys so much. And I'll put in the blog that accompanies your guys' podcast how to contact you. Have a great evening, guys.
Bye-bye.
Thanks so much for having us.
Thank you for having us.
Next week, look forward to hearing from Dr. Julie Gunther of Spark MD in Boise, Idaho. If you like what you heard today, please leave a review and subscribe wherever you listen to your podcasts. Tell your friends too. For more information on this episode and much more, please visit mydpcstory.com. Also, for the latest in DPC news, check out dpcnews.com. Until next week, this is Marielle Conception.